This presentation is going to be covering the topic of gestational diabetes. It will be presented by Nick Sukraw and Olivia Robinson. It has been prepared by Stefani Roth, Nick Sukraw, Olivia Robinson, and Clement Belemkoabgha. Gestational diabetes is any degree of glucose intolerance that has its onset or first diagnosis during pregnancy.
Pathophysiology. During pregnancy, carbohydrate metabolism is altered by the release of the hormones estrogen and progesterone. During the first trimester, a rise in these hormones causes both an increase in insulin production and tissue sensitivity to insulin. The release of these hormones may also cause nausea and vomiting, which may further increase the risk of hypoglycemia during the first trimester of pregnancy. In later trimesters, cortisol will increase, causing tissue sensitivity and glucose tolerance to decrease. This will result in hyperglycemia in the later trimesters of pregnancy. Blood glucose levels will remain elevated as glucose is not permitted to enter the cell. The cells of the body will become starved for energy and begin to break down fat and proteins as alternate sources of energy. This can cause the woman who has gestational diabetes to lose weight during pregnancy. Clinical manifestations. The clinical manifestations of gestational diabetes mellitus are similar to those of non-gestational diabetes mellitus. The three cardinal signs and symptoms are polyuria, or frequent urination, polyphagia, or excessive hunger, and polydipsia, or excessive thirst. Other signs and symptoms may include nausea and blurred vision. Also, a woman with gestational diabetes may experience frequent bladder or vaginal infections as a result of glycosuria or skin infections, usually seen on the feet. These are typically the result of poor glucose control during pregnancy. Disease course. Gestational diabetes is an acquired disorder that has its onset during pregnancy and lasts the duration of the pregnancy up until delivery of the neonate. Due to hormone fluctuations, blood sugar levels are typically low during the first trimester and markedly high during the late second trimester up until delivery. Following delivery and the separation of the placenta, hormone levels return to normal and further treatment is usually not necessary. The nurse will be in charge of frequent blood glucose monitoring for the postpartum patient to ensure that blood glucose levels are within target ranges. Outcomes and expectations. Most cases of gestational diabetes mellitus resolve spontaneously after delivery of the neonate and placenta. Insulin therapy is rarely needed following the delivery. If high glucose levels do occur, oral antihyperglycemics may be given alone or in addition to insulin. If oral antihyperglycemics are prescribed, the nurse will first need to determine whether or not the mother wishes to breastfeed, as oral antihyperglycemics are contraindicated in the breastfeeding mother. Also, breastfeeding mothers will have a lower insulin need, which puts them at risk for hypoglycemia. The breastfeeding mother may need a pre-breastfeeding snack in order to avoid hypoglycemia. Diagnosis. Gestational diabetes can be diagnosed in a 1 or 2 hour approach. For the 1 hour glucose tolerance test, the patient will be given a non-fasting 50-gram glucose load. A positive result will be a blood glucose level greater than 126 milligrams per deciliter 1 hour following administration of the 50-gram glucose load. If positive results are seen, the patient will undergo a 2-hour glucose tolerance test. For the 2-hour glucose tolerance test, the patient will be instructed to fast overnight and then ingest a 100-gram glucose load. Positive results for the 2-hour glucose tolerance test include a fasting blood sugar greater than 92 milligrams per deciliter, a blood sugar greater than 180 milligrams per deciliter 1 hour following administration of the 100-gram glucose load, or a blood sugar greater than 150 milligrams per deciliter 2 hours following the ingestion of the 100-gram glucose load. If positive results are seen for this test, further evaluation and treatment will be prescribed. Patient-centered education. The nurse will be responsible for educating the patient with gestational diabetes on how to monitor blood glucose levels frequently throughout the day. The nurse will also instruct the patient on how to properly administer insulin therapy based both on blood glucose levels and carbohydrate intake. If blood glucose levels are not well controlled with insulin therapy alone, oral antihyperglycemics may also be prescribed. The patient with gestational diabetes is often referred to a dietitian or nutritionist to aid them in making the proper diet modifications. Most often, the patient is instructed to divide intake into 3 meals and 3 snacks daily. Also, a bedtime snack may be indicated to prevent nighttime hypoglycemia. The patient will also be instructed to get adequate exercise through the duration of the pregnancy.
Let's review and see what you've learned. The nurse is teaching a client at risk for gestational diabetes about the condition and its effects on the body. Which statement by the nurse would be correct? In the first trimester, insulin sensitivity and production increases, and the third trimester they decrease. B. In the first trimester, insulin sensitivity and production decrease, in the third trimester they increase. C. In the first trimester, insulin sensitivity and production increase, in the third trimester they increase even more. Or D. In the first trimester, insulin sensitivity and production increase, in the third trimester they normalize. Alright, the correct answer is A. In the first trimester, insulin sensitivity and production increase. In the third trimester, they decrease. This is the typical pathophysiology seen in gestational diabetes. B, C, and D are incorrect. A student nurse is educating a pregnant client who has gestational diabetes. Which of the following statements by the student should the nursing instructor intervene? A. Candies, cookies, and soda should be avoided. B. The baby will likely be born with diabetes. C. Gestational diabetes usually resolves after the baby is born. Or D. Insulin injections may be necessary. The correct answer is B. The baby will likely be born with diabetes. This is incorrect because only a small number of babies born to gestational diabetic mothers will be born with diabetes. Answer A, C, and D are all correct statements and don't have a need for intervention by the instructor.